everybody knows that it is radiation, right? But let's say even we let go of that, because they often say, well, if you are going through the airport scanners, then you get the same amount of radiation, it's not that big of a deal. This is very commonly we hear this, right? So let's assume that that is true. So even that. But what does the mammogram do? Like, this was the crazy part. So for me, when I was looking at how many breast cancer estimated diagnosis per year, in 2022, it's 279,731 people. And that's only in the United States. We are not talking about the whole world. This is only in the United States. And then 310,000 in 2023 and 316,000. And on top of it, this is the invasive cases, and non-invasive cases is another 59,000, 56,000. So, and then also in men, 2,790 cases were diagnosed in 2024. Or 2023. So something this actually made me think about is how it keeps increasing. In just the last 3 years, it's increasing every year. So, and then I'll also show you in a moment on how many mammograms are done per year. Okay, so because it's important. But as I was looking at this whole thing and looking at what these numbers show, so I was in this local group, and in this local group, a woman actually posts, I had my mammogram, and then now they want me to schedule an appointment. They found something abnormal. Now they want me to schedule an appointment with the oncologist as well as the surgeon. And what do I do? And then there were 420 plus comments, out of which majority of the women were saying, this is the surgeon you go to, I had the mastectomy here, I had the mastectomy here, I did chemo here, this is where you go. Majority of them. Nobody ever stopped to ask, why? Why do I have breast cancer? And that blew my mind, because how did we go from actually ever wanting to find out why I have this major diagnosis to cutting off our organs? Like, how do you go from that diagnosis, not even pausing and asking, instead everybody is jumping on, and she is asking for guidance. She's like, this is crazy, like, my life was fine yesterday, and I went for a mammogram, and today they are saying something abnormal is here, and I have to go get my breast removed. And then I have to go through chemo. Like, my life just changed, like, forever. And that, I thought, I had to just sit with that, because I kept thinking, wow, how would it feel like for a woman to hear that? And this is a woman who has been to mammogram every year, right? So what did they do in every mammogram? They say nothing, 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 and then one fine morning, yes, you have something. And now you have cancer, you have to do these steps. Go get organs removed, go do, things that will actually make you boiled, make you sick to your stomach, feel awful, but go do this. This is your options, that's it, there's nothing else. And that made me think, wow, so combined total mastectomies from 2021 to 2024 is 160,000. So per year they do 40,000 mastectomies. And I don't really know whether this is true numbers, because with the number of invasive cancers, the more they obviously want mastectomies. That's the first thing that they actually recommend. Even when they have a small lump, they don't almost ever do lumpectomies. They are actually offering mastectomies immediately without really even thinking about the choice. But this is the numbers that we actually could find online. But it was still interesting to me. So typically the recurrence rate is 50,000 to 90,000. So that means that, the past 3 years, that means that even when a person actually gets diagnosed, it's not okay, you get a diagnosis and then you go get your boobs removed and then do a reconstructive surgery, go through chemo, and you may still get it. You don't really know. You just have to actually wait, and it may come back. And then, that's why I said for the rest of your life has changed. You have to actually think about that, worry about it. And the crazy part is, on the American Cancer Society as well as the breast cancer website, like the org, which is the non-profit organizations, you know what it actually said about chemotherapy? So it said, when you're going through chemotherapy, what you would want is milkshakes. And I almost laughed out loud. I was like, okay, this is just insanity when they are actually suggesting these kinds of things. But I do have to say we have made some progress with all of this natural functional medicine, integrative medicine that has come out, because like maybe only 7-8 years ago, on the American Cancer Society, on their website, all of their food recipes were toxic, were bad. Like there was nothing good about it, just like our hospital food is now, right? You could be in surgery, you come out, and people could actually go into surgery, and what do they get when they're recovering from surgery? They get French fries, they get burgers, they get pizza, they get, Jello. These are the things that they actually offer in the hospital, which is just insane to me. Again, somebody is convalescing, and this is what we're actually going to provide them, and that's what it was on the website, but they have actually changed now. So as I was looking at their website, I found out that they actually have some wholesome recipes, and they're actually asking people to eat more vegetables and more, fruits. And I was like, okay, we are making some progress, so I'll take it, because we need to keep making progress. So one of the other things that I want to mention about what this does is mental health. The effect it has on mental health, which is not even talked about, because this woman who actually wrote about it, right? She said she went for a mammogram, and this happened, and she doesn't even know what to do, and everybody is telling her, go have surgery. Go get chemotherapy. This is her option. Like nobody even asked, what do you want? Nobody asked this question. What do you want? What are you thinking? What are you feeling? Everybody in the family starts pushing them to make the choice that they think is right, because everybody is scared now. The word cancer means that's it. Now we have to be afraid, and everybody is afraid. From fear, we never make good decisions. Never. Never. It doesn't matter what it is about. It is not about a disease, it is about a decision in our life. Whenever we are afraid, we never make good choices. And women every day are made to make choices that aren't necessarily what they want for themselves, but because everybody is afraid now, and they think if you don't do it, you're going to die. And that's the only choice you have. And the mental health, I was actually quite, and again, it keeps increasing every year, 26.5%, and it was 30% in 2022, and then nearly 30% by 2022, continuing into 2024. Anxiety rate was 24%, then it went to 28%, and then even the family members, the mental health of family members actually starts going down as well. People who are going through surgery, people who are having chemotherapy, it is a lot on that person and on the caregivers. And this is totally preventable. That's what I want to talk about. The thing is that even though this is all happening, it's all totally preventable. We don't have to do early detection, we can actually prevent instead of early detection only. And so mammograms again, 39 million in 2022, 40 million in 2023, 42 million in 2024. Just in 2025 so far, this is only October, we have already achieved 43.05 million people have had mammograms. So has that actually changed our cancer occurrence rate? Did you see that it was increasing the incidence? It wasn't reducing the incidence. I'm not actually saying that correlation means causation. I'm not saying that. But what I am saying is, with all of this screening, it has not actually changed our incidence numbers, and it keeps increasing. And then they'll say, well, we are just detecting earlier. No, we need to actually do better than that. We need to prevent, not just detect. And so on a normal mammogram, so it's an X-ray, right? A mammogram is an X-ray. So normal breast tissue, benign cyst, and then some calcifications. And that's what they look for in a breast cancer, that, like a little fibrous or a color that's actually more opaque and not as translucent. That's what they're looking for. And if there's something irregular, edges to it, that actually makes it, where they're saying, oh my God, that's it, this is breast cancer. So this was the thermogram of a patient. This is actually the breast page. And as you can see on here, the reason why I'm actually bringing this page up is, so when we do a mammogram, what do? We actually lump up our breast inside this and push it, and then we get a X-ray of that. We get an image of that. So does breast cancer mean something is only wrong with the breast, or something is wrong somewhere else? Could it not be that there is something wrong somewhere else, and this is where it's actually showing up? Instead, we remove the organ that speaks. That's what we do. Oh, you talked? Okay, let me go remove it. And how is that actually going to change the cost? It doesn't. So in a thermogram, what are we looking at? We are looking at so many factors, 17 factors instead of just the breast. So what are the 17 factors we are looking at? Sternum block. What does that mean? It means the sternum is right here. We are looking at things that are moving out of this area. There is a lymphatics here. So the lymphatics needs to be moving. If the lymphatics are not moving, then where does it go? It goes into the breast. So we are looking at the sternum block. We are looking at breast blocked spots, because many of these benign cysts, even, what are those? Those are usually areas where things are not moving. Things are actually stagnant there. The body is holding on to something. So when we see a benign cyst, which is something shows up in a mammogram, what do typically professionals do? They say, yeah, we'll watch it. Why would you watch it? When you know the body is already speaking that there is something here, don't you want to actually heal it, not go remove it? Don't you want to actually remove the cause of it so the cyst goes away? When the cyst goes away, then we have actually healed the breast on its own. The body that made it can also remove it. But if the cyst never goes away and we just keep watching it until it turns cancerous or another cancer spot comes up, that makes no sense to me. So, but we are looking for breast blocked spots. It doesn't even have to be a cyst. It can just be that the lymphatics is not moving in some parts of the breast. We are looking for that. We are looking for breast asymmetry. That is, if there is more activity in one breast versus the other, that breast is something that we need to look at. And again, in natural medicine, we look at everything and understand that the body is talking to us. Right breast versus left breast. So it could even be emotional factors that could be contributing to one breast actually acting up a certain way than the other. And then liver block. Again, our liver is actually regulating all hormones, including estrogen, progesterone, testosterone, thyroid hormones, all of it. So more often than not, most breast cancer is estrogen dominant breast cancer. That means that the person actually has a lot of estrogen that is not properly metabolized and used, and that's feeding the cancer cells, and it's actually growing. So estrogen causes things to grow. So that's the reason why when a woman, usually when she goes from a girl to a woman, puberty, she actually produces a lot of estrogen, so things grow. So the same thing when it happens when we are later in our years as well, where it's not properly utilized, we have a problem. We have things that shouldn't be growing. Not things that should be growing. Things that should not be growing are growing. So this is the reason for uterine fibroids. This is the reason for ovarian cysts. This is the reason for breast cysts. This is the reason for breast cancer. When it obviously has been going on for a long period of time, it can become cancerous. And so this is the role of the liver. So if the liver is not working optimally, someone could have higher amounts of estrogen in their bloodstream that's not properly metabolized and can lead to growth happening. So instead of actually addressing the liver, what do? We actually remove those organs and put that person on estrogen blockers. So what do estrogen blockers do? They actually now cause osteoporosis in that patient. That causes vaginal dryness in the patient. That makes them lose their libido. Their hair actually falls out. Their hair becomes dry. So all of these things are happening, and so not only did we go through all of that with the breast cancer, now we continue to go through with things that shouldn't be happening to us instead of actually understanding why this is happening. And then ovary dysregulation. Again, breast cancer, nobody even looks at the ovaries. How crazy is that? So it's a very connected organ because it's one of the estrogen producers. You want to pay attention to that. So we look for that. We look for physiological degeneration. What does that mean? It means, is there things that are actually degenerating? Is there cancer-like activity in the breast? Because just because we saw that, fibrous, opaque structure doesn't necessarily mean that that person has cancer. That's how, we are made to think. I had a patient who was diagnosed with DCIS, that is ductal carcinoma in situ. That's actually stage 0 cancer, so it's not even cancer. But that patient was immediately terrified because the doctor said, wow, you have cancer, you got to go have a mastectomy, you got to actually go through, chemo, maybe not chemo, maybe you just need radiation, but we need to do all of these things. And she was like, what? And all she had was DCIS. So sometimes it's that cannot even be cancer, but it's immediately looked at that way, and so many mastectomies are done unnecessarily even. So, and then tonsil and lymphatic block. Why is it important? Because our breast tissues are mostly lymphatics and fats. That's it. So if the lymphatics, which is actually responsible for removing all of the waste from every organ in our body, also our breast, if it's not working, how is your breast going to be healthy? It's almost like, our toilet is not flushing. It's going to stink up the house. So is the breast. So, and then chest disorder elevated. So we are looking again at the chest lymphatics as well. So not only just the neck lymphatics, armpit lymphatics, but chest lymphatics. And then we are looking at the mouth, because gums as well as oral health is always going to contribute to many different organs' health, and certain teeth are connected to certain organs. And here first molar is connected to the breast. So there have been cases where if you actually had a root canal on this first molar, then this breast is going to be more commonly affected, and if it's this side, it's going to affect this breast more. So at least people who have had root canals that have not been done properly actually have had more correlation of breast cancer. So, and then of course gum disease is another one. So we are always looking for breast and teeth connection. And then overall, is there more lymphatic index being high as a whole in that person? If the lymphatic system is actually trying hard, it has a lot of heavy metals, it has toxicity, it's not moving properly, that person is not drinking enough water, not drinking the right kind of water, not exercising, then this person is keeping more toxicity in their body. And another thing that is never talked about in breast cancer is emotional health. Because emotions sit in the lymphatic system. It's not like magic, it's in our head and then poof, it disappears. It actually is in our body, and it is in the lymphatic system. So people who have gone through certain traumas at certain times can actually hold on to things in their lymphatic system. That's also not allowing the lymphatic system to move. So most often in my practice, what I see is when we work on these things, the body actually starts healing itself. That's how amazing that is. And then we are also looking at stomach for the breast health. So if the stomach is cold and if it's not digesting foods properly, if it doesn't have digestive enzymes properly, then you're not actually going to put nutrients everywhere you need to, and then proper metabolism will not happen. And of course, not only your breast, most other organs will get affected, but breast is also going to get affected, so we are looking at that as well. And then we are also looking at mastopathy, which means inflammation in the breast itself. And then we are looking for heavy metals in the breast. And breast alert means if there is too much of a difference between one side to another, like one side is too warm, one side is too cold, that's actually an alert. It's saying, hey, there's something happening here, pay attention to this. Since we are looking at 17 criteria for this, and in this patient in 2024 it was 10 out of 17 she met, and then in 2025 she only meets 6 out of 17. She did not have breast cancer, but what did we do? We actually took a patient that didn't even have it but has a lot of criteria she is meeting. If we leave her alone, in 5 years she may have breast cancer. But we don't want to wait up until then. She doesn't have physiological degeneration here or there, but that doesn't mean that we wait for it to appear. We see these things, we change it now, so that we can actually, heal it, fix it ahead of time. We do not need to wait. That makes no sense to me to wait and to see once it actually happens. So, and then the oligoscan. The reason why I also want to talk about this is heavy metal toxicity in the breast, in the lymphatics is another one that's very common. Not just heavy metals, but also other kinds of waste products, that shouldn't be in there. It could be plastic. Let's talk about microplastics in our environment, in our clothes that we wear, right? So there are microplastics in so many things that is causing estrogen dominance for us. And it is in our lymphatic system. So it is going to have an effect on us. So this actually shows us all of the minerals that supports the detoxification or removal of these heavy metals that shouldn't be in our body. So if we know what the status of these are, then we can do something about it. Then we can fix it ahead of time. We can actually give the body the nutrients that it needs to work on what it needs to work, so that we can take care of it on its own. So is vitamins. Minerals as well as vitamins are our protective, defense mechanism. If we don't have enough of it, we are in trouble. And again, this patient, just between August 2024 to October 2024, you can actually see how many yellows she had and how many greens she has now. So again, when we focus, and she didn't have any condition. She actually came to me for high blood pressure. That's all she came to me for. Okay, so what did we do? We actually did this so we can tell her, hey, look at your magnesium, it's low. So what would that do? It will affect your heart. It will affect your heart muscles. So if it affects your heart muscles, your heart isn't going to be able to relax. So your blood pressure is going to be high. So we worked on that and we took her off of her blood pressure medication, and I also took her off of, like a couple days ago, we took her off of the blood pressure medicine that I gave her as well, that was natural. She doesn't need it anymore. Why? Because her body is doing so well. Her numbers are great. She doesn't need it. Because her body is doing the job now. Medicine isn't doing the job, whether it's natural or artificial. So this is the heavy metal report. And again, one of the things that I want to point out too is heavy metal intoxication. The second thing right there where it says overall intoxication and blockade suspicion for heavy metal elimination. That's something that I want you to pay attention to. So in this patient, she actually was not excreting heavy metals properly the first time. That was in August 2024. So that's why it's in red, the red line that we see. And then over here, the blockade suspicion went down to 10% from 70%. So she was not excreting well there, and here she's excreting well. So this is what we can do with the patient. Even though on her barium, if you notice, her barium went up a little bit, and so did her cadmium, as well as her bismuth. So those numbers actually went up. So even though her heavy metals, because she was not drinking the right water, even though we told her to get reverse osmosis system and all that, she didn't believe us first. So, and after this test, she actually found out how those heavy metals increased, but her body became better at removing it, despite the fact that she had more heavy metals here. So this isn't necessarily showing that all of the heavy metals are completely removed, but once her body is a good detoxifier, now it's going to eliminate things better. And that's what we want. We want our bodies to become better at removing things, because we can't really stop exposure 100% of the time. We can take care of our clothes, we can take care of our food, we can take care of the cookware that we cook with, water, things like this. We can pay more attention to that for sure, because we don't want to obviously put crap into our body. But we cannot stop it. It's not 100%. But what can we become? We can become better eliminators. When we become better eliminators, we actually can remove things on our own. The same way with oxidative aggression and oxidative protection. So even though because of the heavy metals increasing, her oxidative aggression increased here, it became yellow, which was green there because of the lesser amount of heavy metals. Her protection was very poor. That means there is nothing much to protect oxidation that was happening. So that was only at 25%, and that went up to 75%. Of course, she changed her diet as well, which is very important. And we always talk about those kinds of things because they all go hand in hand. It's not just remedies and understanding things. So what is the message here? Why did I want to actually talk about that? Because I want people to actually know things ahead of time. Get your thermogram, get your oligoscan once a year. Know what's happening in your body. Take action. When we see something like this, a lot of times people think, oh, okay, it doesn't say in that patient, like 10 out of 17. She may say, okay, do I have cancer? No, you don't have cancer. Okay, then that's great. But if you didn't do anything about it, will it actually become that? Because it's that number. So what do I tell my patients? Right now, you don't have it, which is great. But that does not mean that we don't address these kinds of things. We address these things ahead of time. So you don't become another number, another statistic that we actually put up here. You become someone healthy, empowered, and educate other people so more people can actually take steps towards our physical health, our emotional health, our psychological health, and our spiritual health, because all of that matters in breast cancer, not just what we eat. Questions?